everybody, welcome back. This is part two. Dr. Bubbs, we are going to follow through what we talked about last time in terms of doing an awesome squat, right?
For sure. So last time we talked a little bit about ankle mobility and assessing whether or not you do have adequate ankle mobility to get you in a good position, especially if you're going to be loading the back. So hopefully you've had a chance to crack into a little bit of that, and now we're going to look at the hip and the T-spine.
So one of the big things that we want to be able to talk about is that I think everybody has a tight hip flexors, right?
I think sitting at your desk, sitting all day, a lot of different sports, whether you're a hockey player or a cyclist, all these things that contribute to that, really jamming up into the hip joints. So I think that's pretty fair.
So to just go over the basic, the functional anatomy and what it does, predominantly is a very strong muscle, right? That causes me to be able to lift my leg, right? And the opposing muscle would be the glutes, right? Which actually does the hip extension. So one of the key things that we want to be able to do as a consequence of like sitting or this biomechanically poor posture, this becomes stiff and tight, which could also become weak, right? But don't want to make it too complicated, right? So what we want to be able to do is like to give you some ideas in terms of how to be able to stretch this, right?
For sure, because the tighter this is, it's going to inhibit as well your glute activation, which is your strongest muscle of the body, or your fifth gear. So we want to make sure that you've got good activation there as well, right?
So talk to me about one of the big things that as I was going through school, and I actually lost this proper hip hinge, which is really a good thing to be able for people to practice, right?
Yeah.
And again, I'm going to do it, and then you be able to again to tell them if I'm doing it right or not, right? So the notion is like if I'm actually doing a hinge, I'm pushing it back. So I'm being able to again to initiate the movement in my hip, and I'm keeping my spine in a neutral position. So I'm not rounding forwards.
Yeah, exactly. If you had a dowel on your back, you would literally have the dowel touching your pelvis, your mid-back, your head, and you would simply tilt forward from the hips, keeping everything together. So the spine is not even moving, you're just taking the whole stack and tilting it down and forward. And if you get it right, you should feel that nice little pull in the hamstrings in terms of the range of motion. If you're rounding in the back, you're not going to feel any pull at all, so that'll be a good cue for you, let you know you've got to that right position.
And if you want to be able to, again, to start at a good place where you actually be comfortable with the movements, you can actually use a wall, and then you'll be able to, again, just sort of get a feel for it, right? So you know exactly how far you need to go, and then trying to get comfortable with the movement, right? So you're creating it from there, right?
For sure. And in terms of even loading, if we do want to make it feel as if you're kind of a little bit coming out and over the feet, as opposed to even a squat position. If we're just working the hinge, it's going to be really happening from the hips. But starting with that's a great way to just feel that back and down. Imagine you're going to sit into a small stool. So it's kind of a nice cue for some people. But to get into those hip flexors, an easy thing to do in terms of stretch would just be to get down on the mat at the end of the day, relaxing, watching TV, something like that. Just get yourself into a nice stretch. Trying to get some extension happening there through the hip. You let that sit in for a little bit. You're going to really feel some opening there. The other thing you can do is actually use your couch, either the back of the couch or where you sit down, and effectively what would happen is you sort of have your knee like in this position here. It would be resting against the couch rather than you holding it, and then you just hold that position there as well. Okay. And of course, if you have any tenderness, anything with the knee, you can just use a pad or anything with a bit of cushioning under there to support the knee. Okay. So that'd be a great way to get some opening in those hips to start with. Dr. T, what will we do to work our way up the spine here when we get to that T-spine?
That was impressive, man. That was you're showing off a bit, man. So in terms of the thoracic spine, again, what we were talking about, it becomes really gunky and then it's not moving as well, right? So there's two moves that we want to be able to do. The one that I really like is actually going to respect what we talked about in the previous episodes in terms of engaging the inner thigh muscles, which really play a role when it comes to any rotational movements in the spine.
Sure.
So I can really support myself and just fire up to do this isometric contraction where I'm just like, holding the block, and I'm going to really lock in and rest my arms against my sternum, and I'm trying to go through this rotational range of motion. And I want to be able to get it here, right? Because this is where we have a lot of movement, right? Mm-hmm. So again, please apply common sense. If you have any injuries, well, you know what? Just come and talk to one of us if you're in a Toronto area, or if you're somewhere else, go consult your healthcare practitioner, right?
Always start slow, let it feel good, and then from there you can work your way up.
And again, we're trying to, again, be able to, again, to give you an opportunity to where you're going to be able to explore these ranges and listen to your body, and then if something doesn't feel right, stop it. But this is a really great one that I want to be able to do. And I think for me personally, I like to go to one direction first, do about maybe 10, and then I want to come back to neutral, and then I want to go to the other side.
And again, a nice exercise that you can do before training, for your yoga class, and, you know, after work, before you're going to be active in the activities that you like to do, just to free that up. Because if you spend any time at your desk, 6, 7, 8 hours at your desk, that area is really going to be locked up, and then it predisposes you to, you know, the low back issues and the neck issues and the rest of it.
And I think the other thing is that you got to realize that if you're doing a lot of mat stretches or exercises, it doesn't necessarily transfer to once I'm standing or if I'm in any other position, right? So the other one that we can do as well is, again, I'm going to get into the quadruped position. Again, support myself here and try to open it up.
Yeah, so you've got a nice neutral spine. He's in that same position we talked about. Knees under the hips, hands under the shoulders. Getting a nice rotation there. He's going to sort of look up towards the elbow as he comes up. And you don't want to take this to 100% end of range. You can just sort of feel it out at a nice 75, 80%. Get some reps going, get some warmth going, and then just really get that movement going. That'll help to open that area up big time.
And again, pay attention to your breathing. Remember all the stuff that we were talking about.
Yeah.
It's not about just trying to focus on one thing, which is actually the tendency, right? You know, the brain becomes so focused on that one thing, but trying to audit the rest of yourself and then to see what exactly is going on.
Exactly. Get comfortable with the movement, then bring the breath involved, and then from there you can really start to feel what's going on in the rest of the body, pelvic position, the rest of it.
I think that's pretty good.
That's good. Lots of homework for you guys. Get cracking.
Have fun, and then next week we're going to put it together, right? And then we're going to do a full squat, and then be able to, again, just go through it, and then be able to also show you in terms of the different variability that exists, because we want to make it yours. You guys do it the way you want to be able to do it, if you respect the principles, right?
Yeah, and you'll see how different people move, and we'll get to show you how you can help to improve your squat based on how our models will show you next week. So stay tuned.
I'm going to wear my t-shirts.